Dr. Conway, whenever you're ready, you can.
Sure. I mean, I can talk for hours. It's hard to know exactly what's most pertinent, but I appreciate everything that you guys are all going through. And I think everybody recognizes that this is both inconvenient and scary for all of us. So I guess I'll give you just a quick overview of sort of how we're thinking about this. So first of all, I think people need to recognize coronaviruses are actually very common. So, maybe 10% of colds during cold and flu season are actually coronaviruses. So these are things that are constantly around. They periodically go bad. There's probably thousands of these things out there. And we've seen them go bad when SARS and MERS showed up and clearly showed more of an invasive and virulent nature. This one obviously, probably emerged from animals as these things usually do and started in China, is basically a respiratory disease like any cold or flu. It's briefly aerosolized when somebody coughs or sneezes and then can live on surfaces for some period of time. They're usually saying 24 to 48 hours. And the way people acquire it usually is by bad hand hygiene and touching their own faces. I think what we're starting to discover is that it's actually quite contagious, and that really nobody in society, despite all of our previous experience with coronaviruses, has any pre-existing immunity to this. Younger people certainly do handle it better in most circumstances, and obviously most of our deaths are in over 70 and over 80-year-olds. But it is obviously easy to spread and has spread quite widely now. And so it's in 159 countries. There's only 192 countries, I think, in the United Nations currently. So it's pretty much almost in every country. There's more cases outside of China than there were in China when they were at when they were the epicenter. And obviously Europe now is the primary epicenter. As of this morning, we have cases in every state in the United States. And I think, the hard part, as everybody's heard about, is that the availability of testing has been extraordinarily limited, even though we've known about this, since back in December, that testing is still, while the technology exists, is still not widely available. And so what we're experiencing currently, unfortunately, is basically kind of lifting up a rock and looking under it and finding what's under that rock. And what's under that rock is essentially that this virus has been here and has already spread throughout most communities, and has probably been doing so for some period of time, different in different parts of the state and different parts of the country. But part of the reason that things have suddenly changed so dramatically and so quickly over the last week is because we finally had the ability to lift up that rock and look underneath it and realize not only more about this virus, but understanding how common it is. And so, you're going to see case counts jumping dramatically because the state lab just in the last day finally has the ability to do about 400 tests a day, and Milwaukee Public Health has the ability to do about 300 tests a day. So we're going to start to see much higher numbers soon. But part of what we've discovered over the last couple of days is that the initial cases that were identified were people that had an exposure and travel, because those were the people that were being tested. Now that we're able to test people who come in and actually have symptoms and are sick enough to maybe need to be hospitalized and are starting to test those people, we're starting to realize that there's quite a few people that have no travel history and have no known exposure. And so that's why people have started to use the term community transmission, and that this is clearly being transmitted in communities. And so that's why you've seen this fairly rapid change in both enforcing social distancing, but also in gradually shrinking the number of people that are permitted to be around each other, because it's now clear that this is very transmissible and lots of people may have it. And so if you think about how we've dealt with influenza for many years, we have the tools to manage influenza. We have vaccines, which, although they're not great, they basically do what we need them to do, which is generally prevent very vulnerable people from getting severely ill. we've been telling people to wash their hands since all of us were in diapers, basically, and mom's been yelling at you for that since you were a little kid. And we've got treatments for influenza, and yet, despite having all those things available, we still have 20 or 30 million cases of flu every year in the United States, and 200, 300,000 hospitalizations. And this year is one of our worst years in in a while, and we're pushing towards 20,000 deaths, and 150 kids have died, primarily healthy kids and primarily unimmunized. So part of what we've had to do from a public health standpoint is realize we've given society the tools to manage influenza, and they have not done a particularly good job. Only 42% of people even get a flu shot. We just can't trust them to manage things and do what we tell them to do. And so despite telling people to stay home when they're sick and to perform social distancing, it's been clear that people just aren't capable or willing to do those things on their own. And so that's why you've seen public health authorities and the governor and the federal government increasingly ratcheting up the restrictions, because unfortunately, unlike influenza, the only thing we have to prevent people from getting COVID-19 is by keeping them away from other sick people. And so that's why the dominoes have fallen so drastically and so dramatically. And then just a couple of things just to give people some perspective on kind of what it is we're looking at. When we're talking about the population that's at the greatest risk, obviously everybody's focused on the over 60 age group. And that's about 76 million people. But when we add in the other medical conditions that seem to suggest that you're at higher risk for having a bad outcome, and you add in heart disease, cancer, chronic obstructive pulmonary disease, and diabetes, which is why Dr. Pollack asked me to be on this and why I appreciate you guys thinking about all this, that group of those four conditions, heart disease, cancer, COPD, and diabetes, seem to represent the majority of that other group. And that's about 30 million adults between the ages of 18 and 59. So we're basically sort of looking at the fact that about 105 million Americans are the ones that are at highest risk for having bad outcomes. And so then you may ask, well, then why are kids in schools the ones then kind of getting dragged into this? And it is unfortunate, but obviously many of these people come into contact with kids. We know that kids do get infected. There's plenty of data out of China that shows that kids are perfectly able to get infected. And unfortunately, in some of the data that's been coming out from Europe and China, about 13% of those kids may have absolutely no symptoms or be just mildly symptomatic and still be able to transmit the illness. And then add in the fact that while people have been going around saying that kids do just fine with this and it should be no big deal, while there's no kids under the age of 9 that have died, in the Chinese experience, about 50% of the kids did get moderate or severe disease. So while some, 13% were asymptomatic and, 30 or something percent were minimally symptomatic, about 50% of them had either severe or moderate disease that did require medical intervention.